Welcome to Bio 181. This is the first semester of General Biology for majors. The second semester, Bio 182, is going to cover a different set of material, fundamentally different, which I'll describe here in a little bit. But before we get into the mechanics of the course and that description, I want to talk a little bit about what this course is all about and what our focus is. I'm going to start here. You're looking at a picture of two people. The physician on the left is a gentleman named Dr. Kent Brantley. The person on the right, also dressed up in the biohazard suit, is somebody who I'm afraid I don't know. They are both treating this patient in the country of Liberia, city of Monrovia. This was during an outbreak of a disease called hemorrhagic fever. Hemorrhagic fevers are awful, awful things to have. Basically what happens in a hemorrhagic fever is a person will, over time, develop more and more symptoms of something like a cold that just keeps getting worse and worse and worse. And eventually they start swelling, getting a lot of inflammation, and they start to bleed internally. The reason they start to bleed internally is because the disease causes small blood vessel ruptures throughout their body constantly. And the body then, of course, responds by forming clots. The clots use up what are called clotting factors. These are proteins in the blood that are involved in making the clots. And those proteins get completely used up after about 2 weeks. After that time, once a new bleed begins, there's no way to stop it. The blood can't stop it because it has no factors to stop it. And this happens throughout their body, and so they start to bleed everywhere. Their eyes get bright red because the capillaries of the whites of the eyes start to bleed. They start to bleed from the nose. They start to bleed from their ears. They start to bleed from everything. And when that happens, they have about 2 days. And then, unfortunately, after that, they will bleed out and literally bleed to death, and there's nothing that anybody can do to stop them once they get that far along. So the goal is to keep them from getting that far in the disease process. And that's what Dr. Brantley is doing there on the left. He's working with this patient to try to keep that from happening. Now, at the time that this hemorrhagic fever case broke, and actually the epidemic broke, nobody was absolutely sure what it was. And so doctors, physicians, and scientists, PhDs, not MDs like Brantley, but PhDs, were responsible for finding out what the disease process was being caused by. Hemorrhagic fevers can be caused by all sorts of different disease viruses and bacteria and things like this. So they took those samples and sent them to 2 different locations. They took samples from patients and sent them to 2 different locations. One in Johannesburg, South Africa, and one in the CDC in Atlanta, Georgia. And scientists and researchers there discovered that the cause of this patient's disease was this Ebola virus. And so the patient in this picture here is suffering from Ebola virus disease, and Dr. Brantley is trying to keep the bleeding out process from occurring. This particular disease is something that is relatively new. It was first discovered in the mid-1970s, and this graphic shows you a lot of the details of not only its pathogenesis in the upper left, but also all of the cases that have occurred and the big outbreaks that have occurred. In this picture with Dr. Brantley, this was in 2014, and this patient was right in the middle of the largest epidemic of Ebola that we've ever seen. And you can see this here on the right-hand side of the graphic, that this particular case, or this particular epidemic, was just awful, the highest we've ever seen. Unfortunately, there's currently another one going on that just started a few weeks ago, so we're in this again. It's in the same area as the 2014 outbreak. It might be a continuation of the 2014 outbreak. We're not sure. So, what does all of this have to do with us? What does this have to do with Bio 181 students? Everything. Absolutely everything. Here's why. Dr. Brantley, why is he in that room with this patient? Why is he dressed as he's dressed? He's in the room and he's dressed as he's dressed for the following reason. He is one of the very, very few people on the planet, way less than 1/100th of 1% of all humanity on this planet, who has the training and the skills to not only treat the poor patient in the bed and maybe keep them alive, but also to do so safely so that he himself is not going to get infected. As you probably know, Ebola is wildly infectious, and it's very, very easy to pass from person to person. That's why the 2 physicians who are working with this patient are wearing what they're wearing. That's why Dr. Brantley's there. He's extraordinarily highly trained. He got his graduate degree in medicine from Indiana University, and that is not, however, where he started his training. His training in medicine did not start at Indiana University and the medical school. His training began in this class, General Biology for Majors. He is in that room because he took an academic path, the first step of which was this day in this class, the very first day. Bio 181 is not a class in biology. Bio 181 is a professional class in biology. We're going to start learning biology as professionals understand it, not as teachers and educators understand it. So all of the people who were involved in discovering what this Ebola virus was, all of the people who are involved in identifying the causes of these epidemics and all of the pathogenicists in the upper left-hand corner, all of those people, those PhDs, those MDs, all of them began their journey, their educational journey that got them to this point. They're some of the most important people on the planet. They got to that point because they took this class. That was their starting point. And that's what this class is all about. It is majestic. It's important, and that is the attitude that we have the entire time that we're teaching here.